Cystic pregnancy versus ectopic pregnancy. Are they the same? What's their difference? Let's start with cystic pregnancy, also called molar pregnancy. This happens when something goes wrong right at the beginning during fertilization, when a fertilized egg fails to develop normally. Normally, when a sperm meets an egg, both the father and the mother genetic materials combine together to form a healthy embryo which grows into a baby. But in a molar pregnancy, that process goes wrong. Instead of developing into a baby and placenta, the tissue inside the womb starts growing abnormally, forming tiny fluid-filled sac, just like a cluster of grapes. Now, there are two main types of molar pregnancy: complete molar pregnancy and partial molar pregnancy. Now, in a complete molar pregnancy, there is no baby at all, no baby forms, only abnormal tissue growth in the womb. While for the partial molar pregnancy, baby may start forming initially, but does not develop fully and sadly cannot survive. This whole problem happens because of genetic error, usually from the father's genetic materials. When the father's genetic material duplicates or overpowers the mother's own, making the pregnancy abnormal right from the start. And yes, you can still test positive in a cystic pregnancy, but in a very rare cases. This is because some cysts like corpus luteum cysts, can actually produce pregnancy hormones, giving a false pregnancy result. Now, let's talk about ectopic pregnancy, one of the most dangerous pregnancy complications. In an ectopic pregnancy, the fertilized egg implants outside the womb. It has no business with the womb, usually in the fallopian tube. Unlike a molar pregnancy that is in form of a cyst-like pregnancy, in an ectopic pregnancy, this involves a re-embryo. The problem is it is located outside the womb, and sadly, it cannot survive. Now, for the risks involved, a cystic pregnancy can lead to a persistent abnormal tissue growth. In rare cases, it can lead to cancerous growth if not treated properly. For the ectopic pregnancy, it can cause the fallopian tube to rupture, to burst, leading to internal bleeding, and this can be life-threatening for the mother. This is the reason why doctors act quickly once they discover that this is an ectopic pregnancy. You might undergo surgery immediately. If you find my video helpful, give a thumbs up, make sure to like and subscribe.